Yeah, so as KP said, I'm here to talk about the benefits of exercise as part of breast cancer treatment and recovery from breast cancer. I'll fly through this, but first of all, looking at the benefits of exercise for cancer survival, then looking at some of the mechanisms about how exercise improves breast cancer survival, the impact of exercise on some common side effects of breast cancer, and how it can also help maintain compliance with breast cancer treatment, and then some look at some safety around exercise with things like lymphedema and post-surgery. So the big headline, most important thing I would say as an exercise physiologist is that it's been shown that exercise can improve the survivorship and of women with breast cancer. So plenty of studies on it. The one I've picked, almost 5,000 women with stage 1 to 3 breast cancer, and it was found that there was an inverse relationship between the amount of exercise the women did and total mortality, reduced risk of recurrence, and disease-specific mortality. So yeah, the more exercise you do, the better your chances of survival, the lower recurrence rate. And importantly, the results were not affected by menopausal status, comorbidities, so things like diabetes, cardiovascular disease, the quality of life, or body size. So it's a pretty miraculous thing, exercise, and a lot of great outcomes from it. So how does this do this? The next logical question is, if it improves survival, how? Going to get a little bit jargony here, but it's the effect that it has on the tumour microenvironment. So the tumour microenvironment is all the structures and the environment directly around the cancerous tumour. And yeah, particularly in the case of cancer, it's the blood vessels, but it has impacts on the whole tumour microenvironment. And as I'm sure you can imagine, the tumour microenvironment and the cancer are constantly interacting with each other and having direct effects on each other. And unfortunately, cancerous tumours produce a number of effects that help promote their growth. The primary one for that is the impact that cancerous tumours have on blood vessels. So what cancers tend to do is they'll collapse blood vessels and make them really leaky and porous, which results in a reduction of blood flow through the cancer, which causes hypoxia, which is low oxygen levels, which leads to an increase of acidity in the tumour, or in the cancer. And this increased acidity leads to a series of signals that tell the body that it doesn't require an immune response. So one of the ways that cancers avoid an immune response is by reducing the blood flow through them, by kind of ruining the blood vessels, as you can see there. And that allows the tumour to grow without too much immune response, and it also increases the risk of metastasis. And one important thing that exercise does is it improves the integrity of the blood vessels running through the tumour. So it helps prevent that disruption to the blood flow going through the tumour and make sure the oxygen levels don't drop, and importantly, as a result, make sure that the immune response to the tumour is still strong. So it helps the immune system react to and attack the cancer. And that is really important for those of you or those undergoing immunotherapy. And there's some really interesting research on the role of exercise as an adjuvant treatment to immunotherapy, because the increased blood flow through the tumour helps immunotherapies work better. Similarly, with chemotherapy, it helps improve delivery of the chemotherapy and the immunotherapies to the cancer. I've just summarised that accidentally. Exercise Right is run by ESSA, which is, as an exercise physiologist, they're our accrediting body, and they have a lot of really good information on exercise, including exercise with cancer and breast cancer. So as you can see there, as they've summarised, it increases the level of cancer-fighting immune cells, improves therapy, and improves the delivery of immunotherapy. And then next, importantly for breast cancer survivors, it is the impact of exercise on the side effects of cancer and breast cancer treatment. So as I'm sure you all understand probably better than I do, there's a lot of really nasty side effects with breast cancer and treatment. I'll highlight fatigue and the cardiotoxicity, but exercise can have a really positive effect on the nausea, the cognitive impacts and the psychological impacts. I'm sure you all know the importance of exercise in treating psychological issues, and that obviously continues on with breast cancer. So, exercise and breast cancer related fatigue. So, fatigue is one of the most common side effects. One estimate is 99% of women undergoing breast cancer treatment will experience it. And as counterintuitive as it may seem, exercise is really good for fatigue. So I'm sure all of you could appreciate if you're experiencing fatigue, the last thing you're going to want to do is go out and exercise, but it is the best thing, or one of the best things you can do, and it's been found to be as effective as most pharmacological interventions or psychological interventions. And yeah, it's one of those things, if you get out and exercise and move, it helps reduce your levels of fatigue, which then has the positive impact of allowing you to exercise more, which as an exercise physiologist I'll always encourage. The next one, and this was at Lee's suggestion that I included this, and it's really important, it is the reducing, exercise helps reduce the risk of cardiac toxicity, especially that associated with chemotherapy. So as you can see there, anthracycline-based chemotherapies can have a really big impact on cardiovascular function, which then post-treatment can obviously have a really big impact on your quality of life. And if you maintain aerobic exercise during treatment, and they're starting to do that more and more, university, I was doing a Masters of Exercise Medicine Oncology from Edith Cowan over in Perth, and they've worked with the Charles Perkins Centre, Lee? Charles Gardner Centre. They've got a gym right next door to the chemotherapy suite. So you go out, straight around the corner, straight into the gym to exercise. And it's been shown that doing aerobic exercise during chemotherapy treatment can help maintain cardiovascular function and reduce the risk of cardiovascular disease later on in survivorship. Yes, they did, yeah, with Robert Newton and the guys and Edith Cowan. So, yeah, it should be on ABC iView if you guys want to watch it. It's a really, really interesting piece. Then treatment compliance. So, like I talked about, there's a lot of side effects with breast cancer treatment, and there's a lot of risk of treatment toxicity, so chemotherapies and immunotherapies just causing side effects that get to the point where you either cease treatment or you have to greatly reduce the planned treatment. One of the biggest risk factors for having treatment toxicity is low levels of muscle mass. So, and this similarly goes for the risk of lymphedema, is low levels of muscle mass increase the risk. So if you are able to maintain some resistance exercise or weight training during treatment, it'll help maintain your muscle mass, and it should help or reduce the risk of treatment toxicities and allow you to continue on as close to as possible the planned treatment regime. Post-surgery, as an exercise physiologist, I'm not trained to deal with this, but Lee, a breast care nurse like Lee, or a physio like Aaron here, will help with the acute wound care post-surgery. Once the scars are all healed and you've got the all clear, then you can come and start exercising. And with this, I would caution it's important to work with an exercise physiologist or a physiotherapist, someone who can adapt the exercises to suit you, because with the scarring and things like that, there'll be altered ranges of motion, so making sure the exercises you perform are both safe and effective. Lymphedema, I won't talk too much about because Lee already has, but yeah, obviously it's beneficial as Lee highlighted. We'll race through it. And then exercise and metastasis or metastatic breast cancer, the same benefits apply. It'll help, if you're still receiving treatment, it'll help manage the side effects. If not, it'll help improve the quality of life and reduce fatigue, and a lot of the side effects can linger long after treatment ceases. So I'm sure you know, and exercise can help improve those longer lasting side effects. And then the final one, what kind of exercise should we do? So the Clinical Oncology Society of Australia released a really good position statement on exercise. I want to highlight the first part of this is exercise should be embedded as part of standard cancer care practice. So really, really important. The exercise guidelines follow the general guidelines for physical activity and health. So aiming for 150 minutes of aerobic exercise a week. So really simply, that can be just 5 30-minute walks a week. And this is also graded as to where you are. So don't think your moderate level of activity is the same as someone else's. Do what you feel is a moderate level. And maintaining or doing 2 to 3 resistance exercise training sessions a week to maintain your muscle mass. So in the gym, it'd be a 5 or 6 exercise little routine. And ideally it's supervised by either an exercise physiologist or a physiotherapist. Fortunately in Coffs we have an excellent cancer group exercise program called CanX that is run by Aaron here at Mid-North Coast Allied Health, so I'll get Aaron up to talk about that.
Thanks, Hugh. I'll be very quick. I know I'm already going to get a minute before I even start, but my name's Aaron Hardaker. I'm the Managing Principal at Mid-North Coast Allied Health. As Hugh said, we run a program called CanX. Anyone heard of it? Excellent. How good is that? I thought we were going to get a couple of hands. So CanX was born out of the fact that we've heard for a long time all those things that Hugh's just said about how beneficial exercise is during the cancer journey, but we just weren't doing it. So we created a program about 5 years ago that involves 8 weekly sessions of group exercise tailored to the individuals in the group. We do an initial assessment with the exercise physiologist, and we do another assessment at the end of the program. And that program has been unbelievably successful at not only implementing exercise for people that didn't want to exercise, but also then changing the behaviour of exercise ongoing. So we've heard already how beneficial exercise can be. It can increase survivorship, it can reduce recurrence, but we're just not doing it. So our program is predominantly funded through Medicare and through donations to the Mid-North Coast Cancer Institute, available for anyone with any type of cancer. And the benefit has been that we see improved measures in strength, endurance. We see huge improvements in fatigue, as Hugh talked about. So as he was saying, it seems counterintuitive that if you're tired, you exercise and you feel better, but that's exactly how it works. So the research that we've been doing for a good while now shows that in individuals, the feedback has been great, but more importantly, what it's done is deliver a social network to exercise with as well. And I think that's been probably one of the most powerful things, and one that we're actually now looking at capturing more data and more detail on, because that quality of life change is huge. So I don't think I need to sell it. I think you just need to do it. And it's not just about CanX, it's about any sort of exercise. So we've seen people after doing the group then go on to join a gym, to make a buddy in the group that they go walking with. They might continue. We've started a post-CanX group because people just wanted to keep doing the program, or seek out, specialists like Hugh that bring the skills and knowledge that you need to make sure that everyone can exercise. Exercise isn't only if you're fit and healthy. That's the last time you should need exercise. It's all about getting the benefit. And I use an analogy, and I'm sure plenty of people in the room have heard this before, but if we did a whole lot of research and found a chemo drug that was more effective at treating the cancer and improved survival rates, and we just switched to it. But why aren't we doing that with exercise? It's still not routine enough. And if nothing else, I'd love you all to leave here today knowing the importance of exercise and spreading that word. And if you're interested in CanX or any other form of exercise, dragon boating, fly fishing. I didn't know fly fishing, but that's cool. But do something. I think that's the message that we want to get across. So thank you. Cheers.